Good morning, everybody. We are almost at the end of our school year. This is the last schoolish thing I've got for you. So, we are wrapping up our short health conversation for this year. We're going to get more depth next year in 7th grade, so don't freak out. And once again, the computer is not obeying me. Okay. Rules. Be respectful to yourselves, to each other, to our class. Be mature. Some of this is going to make you uncomfortable. That's okay. It's not okay to make somebody else uncomfortable on purpose. Pregnancy. So last time we were talking about menstruation, periods. Periods are the thing that let babies be possible. A period is what happens when a body gets ready to have a baby and there is no baby. Now we're going to talk about what happens when there is a baby. So first things first, a baby, when it very, very first starts out, isn't actually called a baby. A tiny human outside of its mother is a baby. A tiny human inside of its mother is called a fetus. However, a tiny human before it looks anything even remotely like a human is called a zygote. A zygote is what forms pretty much right after sperm and egg meet and the start of a baby happens. You all started out looking like this. When you came out of your mother, you looked more like this. Newborn babies are kind of weird looking. They're covered in all sorts of gunk. This is the umbilical cord. They tied it off so the baby doesn't bleed to death. Yeah, newborn babies are very strange looking. So, everybody always says, oh, it's 9 months. It's closer to 10. So, a baby develops for almost 10 months inside of the uterus. The uterus is an organ inside female human beings. Female is, again, a biological sex rather than a gender. Female and girl aren't the same thing. Anyone who is female and their organs are working right can have a baby. So the uterus is basically a balloon made of muscle inside of the body. It stretches and goes back to its normal size when the baby is gone. These almost 10 months, a lot of that is just the basic development to make a baby possible. The last couple months, however, are very, very important for the health of that baby after it's born. Premature babies can have low birth weight, their lungs, heart, or brain can be underdeveloped, and low birth weight can often have other health impacts. Premature babies can have health problems as they get older. They can have trouble putting on weight as they grow. It can cause a bunch of problems. If you look down here, this is a chart of what a developing baby looks like at different stages. Notice that for most of this, they kind of look like a little alien, especially right down here. The cool thing about babies when they're in these really, really early weeks is that if you look at any mammal that's dogs, horses, elephants, dolphins, humans, way early in pregnancy, most of our babies look exactly the same. It's only in the later time that they start to look kind of like people. And it's only at the very end that they start to actually look like babies. So, actually being pregnant. Pregnancy starts when the zygote attaches itself to the uterus and starts to grow. Remember that zygote is this very first little clump of cells that makes up what will eventually be a baby. So pregnancy is when the zygote attaches itself to the uterus and starts to grow. Miscarriages are a thing that it's not uncommon. It happens to a lot of people, and most of the time, miscarriages happen without the woman ever knowing that they were pregnant. And it's a thing that most times when a miscarriage happens, there's no negative effects. Again, the person may not have even known they were pregnant. A lot of times it just ends up being a very heavy period. Later term miscarriages are the ones you tend to hear people talk about when somebody lost a baby before it was born. Those are later term miscarriages, when somebody actually knew that they were pregnant. So the mom's body gives the baby everything it needs. The placenta is a blob of tissue and blood vessels that basically just passes stuff back and forth from mom and baby. It's how the baby gets food and oxygen, and it's how the mom gets rid of the baby's waste products. The placenta is also really cool because it helps protect the baby. So the placenta kind of filters out stuff like bacteria. There are some things that can go through the placenta, but a lot of the times it keeps negative stuff from getting to the baby. So if mom is sick, baby's not necessarily going to get it. Fun fact, you peed inside of your mom. There comes a point when the baby's urinary tract starts to work and they start being able to pee. And then they drink it again. And then they pee again. So yes, child, you peed inside of your mother's and then you drank it. It's a normal thing. It helps the baby's system start to function, but it's still very, very strange and endlessly amusing to me for some reason. So pregnancy is a very long process and it's a very complicated process. Unfortunately, it's also not a very fun one for moms. There's lots of stuff that just makes it not a nice thing to go through. Mothers can have nausea. You guys might have heard of morning sickness. Fun fact, it doesn't just happen in the morning. Morning sickness can happen at any time of day, at any stage of pregnancy, and it's just totally not fun. Morning sickness is a thing where people just get randomly nauseous, feel like they're going to throw up, and oftentimes do throw up. Mothers can also get heartburn, which is kind of like it sounds, a burning, painful sensation in your chest. They can get cramps, cravings for food, or opposite, they can feel a food that they really, really love suddenly smells disgusting. They can have trouble sleeping. There can be swelling, usually in like the feet and the ankles, which can make walking uncomfortable, standing uncomfortable, can make it harder to wear shoes. There's also a thing where some women develop diabetes during pregnancy. I don't know all the details of it, but it is a thing that some women develop diabetes while they're pregnant. Sometimes it goes away, a lot of times it doesn't. And diabetes is a disease where your body doesn't really handle sugar very well. We talked about it a little bit when we did our sugar project. This next one can be a little bit dangerous. There's a lot of medications that aren't safe when someone's pregnant. And a lot of times, people who are pregnant have to stop taking their normal medications. This can be anything from allergy pills to antipsychotics, which are things that people who have severe mental problems sometimes have to take. So, depending on what medication the mother takes, they may have to change medications or stop taking it at all for the health of their baby. And that can cause anything from mild inconvenience to fairly severe health risks to the mom. So this one, they may have to stop taking normal medications. That one and the diabetes one can be actually dangerous to mom. Pregnant people are also tired a lot. They have to pee a lot more often because the baby is sitting right on top of the bladder. When we looked at anatomy, you might have noticed I told you that the uterus is right on top of the bladder, and that's why pregnant people have to pee more often because the baby is just squishing their bladder so it doesn't hold as much pee. Pregnant people Oh, excuse me. Pregnant people can also suffer from constipation. You may or may not know what that word means. Constipation means you can't poop. And that can get very uncomfortable very, very fast. Moral of the story? Go apologize to your mom for what you did to her. So, pregnancy is not something that everyone can experience. If you do not have a uterus, you cannot get pregnant. Some people with uteruses can't get pregnant for some reason or another. It's hard to describe fully what it's like to be pregnant, but there are things that let people experience a little bit of what it's like. So if you look in this picture right here, this is something called a pregnancy belly. And basically it simulates what it feels like to be pregnant. These are weighted and they can be like 30, 40 pounds. And there are little knobs on the inside that push in to simulate the pain it feels like to have a baby pushing into your organs. Because you may not have ever thought about it, but as a pregnant person's belly gets bigger, that's because the baby is getting bigger. But the belly gets bigger and the baby pushes some of your organs out of the way. It pushes intestines and bladder and liver and all sorts of stuff. It moves the inside of your body to make room for itself. And these pregnancy bellies can be used to show kind of just how uncomfortable you can be. It shows how uncomfortable it is to lay down, and it shows how much it can make your back hurt. On this side, however, we have a fun thing. This is a labor pain simulator. If you see these, you can't really see it in this picture, but these little sticky pads, you can see it better here, these little sticky pads, they use those to electrocute you a little bit to make your muscles contract. Because during labor, all of the muscles in the torso and on the back contract to try and push the baby out of the body. And these little stickies make those muscles contract and can show people kind of what it feels like to be in labor. So there is I think it's about 8-minute long YouTube video here, and it's women trying out a fake pregnancy belly. This is supposed to be a 2, to see how being pregnant impacts their day. So this isn't this belly, it's just a little rubberish thing that makes them look more pregnant. And they were doing this to see how pregnant people are treated differently and how they experience their day differently. It's a pretty interesting video. You don't have to watch it if you don't want to, but it just shows how people treat pregnant people differently. So you start out as a couple cells. You come out of your mom's covered in goop and looking like this. We start out looking like aliens and then turn out looking kind of like people. The placenta is the thing that helped keep you alive inside your mom. Being born too early can be very dangerous for the baby. You peed inside of your mom. Pregnancy is not easy. Moms have to put up with a lot of stuff. It's very uncomfortable. There are some things that let people experience some of what it's like to be pregnant. So I'm posting an assignment for you in Google Classroom, and I want you to go ask someone you know who had a baby. It can be your mom, it can be your aunts, it can be your grandma, it can be cousins or sisters, someone you know who has had a baby. And just ask them what it was. And I'm gonna put a little Google form, and it's just gonna be a short response. You don't have to write me a big long thing. Tell me what they say. So I mentioned earlier that this is basically the end of our year. On Monday, I'm just going to post a movie that you guys can watch if you want to. It's not going to be an educational movie. It's going to be like, an actual movie. Though I do have one announcement. And if people didn't watch this video, they're probably not going to see this announcement. But I am not going to be teaching 6th grade next year. I am going to be teaching 7th grade. Yes, that's correct, children. I shall be following you to 7th grade. That'll be fun. We still don't know what the school year is going to look like next year, but I will be there, watching your every move, waiting. Okay, I hope you're all doing okay. And I may or may not see some of you at Zoom today. I love you all. I hope you're all doing okay, and I shall see you at some point. Farewell, children.